Okay, now what do you do? Can you even put an implant in there? Well, not exactly, no. So there's always different things that come along, so there's a need for, you know, more and more treatment that can become more expensive, obviously, than routine. It's not just a filling or one crown every few months or something, or a few months, years, hopefully. You know, but it depends. So you don't know what the future is, depending on how healthy. Health is your wealth? Yes, it is. Yes, it is. Force per unit area. When you bite down, these muscles and everything are pretty constant. It's what's supporting it, you know. In other words, to be an American Dental Association approved material on compression in the back teeth, in the posterior teeth, it's over 40,000 psi. It's like, oh my gosh, that's horrific. Until you see fillings that break that will test that, and metals that break, and porcelains that break. So no, there's a lot of force. Okay, so we got the same force, then you take away half the teeth, you put a couple partials in there, or bridge work or something like that, which has got, you know, maybe 2 teeth taking the load of 4. Gee, I wonder why that's going to fail. You have to think about that.
What is it doing? What type of work is happening in there?
So you come in as an older person, you're 60 years old, and you got a couple of real long span lower bridge work, or we call them fixed partial dentures. Well, yeah, and how long they've been in there? Oh, yeah, I've been in there 15 years. Well, you know, chances of you getting to the end point in life for another 20 years, you'd have to say, well, you know, we better count on failure, partials, you know, redos of things. And just put that aside and maybe come up with a plan per year that you can do self-insure.
So that's one of the things that I think I'll be talking to people about in the future, is just making sure they do have the conversations with their own dentist and then with their parents' dentist, just so that they have an idea of what they're going to be spending. As we wrap up, if you were, let's say there's a young person out there that's in high school that's listening to you, and they're considering getting into dentistry, what advice would you give that young person?
I would do it. If you like to work on finite things and you're detail oriented, it's a very good profession. In fact, some you know, as far as if money is an issue, it's not for me. I enjoy what I do. I never go to work. I like what I do. I really, honestly love what I do. I make things, and I am in hog heaven whenever I make stuff. I don't care how hard it is. The harder it is, the better. If you've got that kind of a mentality, you'll fit into dentistry beautifully. You got to want. You like to have challenge. You like to work on detailed things and very detail oriented. That's the basically the sort of the background or you know, mentality that you need to have, I think, to be successful. And but I love treating patients. You know, make people smile. It's the wind into the soul, as one of my mentors said, and it is. I think your smile is, and being able to be part of that, and that's what prosthodontics does. That's what my partner and I try to do every day, is take an old yucky looking denture, smile, partial, whatever it is, and really make it nice. And we have, you know, but that's
it makes them comfortable enough to smile, so they have to live with it.
They have to, and that's the point. Is you know, like to be. You have to. I think in dentistry you have to be very A-type personality, outgoing. You have to put people at ease. That's the negative part of it, is when you give people injections and so on and so forth. You need to, you know, be, you know, empathetic but skillful in order to get through that part, because you know, we can't put everybody to sleep. Right. You know, and sometimes the nitrous, you know, kind of works on some people, but it gets in the way of what you're doing. And so it's a very good profession. It's up on the top as far as money. Okay. Particularly if you get into certain specialties, and prosthodontics is one of them. The more rare you specialize into whatever field, usually the remuneration is better. Offer that. You have to keep your ethics. You have to put the dollars behind and the patient forward. And if you have that kind of you have to get, it's a giving.
Put their
thing.
Needs in front of your own.
You're a true professional, and ethics are really, really important. That's something that bothers me. And I think ethics in our society today, you want to make a difference in healthcare, you must be ethical.
And that's one of the reasons why I want people in my generation, the sandwich generation, to learn as much as they can, because they have to help their parents to make sure their parents don't get taken advantage. Now, if people want to reach out to you, if they want to come in for a consultation, tell everyone how they should reach.
you know, if you'd like to see somebody like me that can kind of give you a little prognostication, if you want to call it that, I'll be glad to do that. I mean, you can do that. We're in Woodstock, Georgia, and in Atlanta, Georgia on Roswell Road. Woodstock is off of 92 on Wood Park Place. gadentures.com is our site. As far as phone numbers, it's probably in my phone and not in my brain. But one number I do know is 770-926-0021. That's the Woodstock, but it goes all over. There's somebody will be there.
I'll add the phone number to the lower.
Yes, that'll be good. That'll be good because we got a bunch of phone numbers, and you know. So, but anyway, that's my advice, particularly to the sandwich generation. That's really important, is to really get. And if you don't like what you're hearing from a provider, get another opinion. I don't take offense to that at all. No healthcare provider should.
So if you hear something, if your parents are telling you something about their dental care and it's not making sense to you, please, 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 please get a second opinion before they start that treatment plan. I want to thank you for coming out today.
Yes, I appreciate it.
And you'll have all of his contact information, his website information, the proper telephone numbers.
Yes.
And we'll see you next time here on M&O's Money.